Welcome to the Sexy Side of Menopause podcast. I'm Beverly with Beverly Hills Health and Wellness Coaching, and I am here bringing phenomenal women to talk to you about their experiences on the menopause journey and how they are rocking life during this stage. And they are definitely on the sexy side of menopause. And do I have someone for you today? You would not even guess she was like in a menopausal journey. She looks amazing. I met her about a year ago now, and she left such an impression with me. And she's like, "Oh, we have to do something." So we had a chat, I don't know, about 6 months ago, and it kind of went flat. She is a medical doctor. I call her Dr. Karen. I will let her formally introduce herself, but she has so much great information for you ladies going through the menopause journey and you need medical help. So, Dr. Karen, welcome. I'm so delighted to have you here. Please introduce yourself to the audience and let's have a conversation.
Hi, Beverly. It's so nice to finally be here with you. I know we've talked about doing this off and on for so long. So thank you for being patient and having me as your guest today.
Well, it is such a delight. So let's talk about what you do. You're a medical doctor. I am a certified health coach, so I help women that are starting this journey, throwing their hands up. They don't know where to get started and lead them down a path that's holistic in nature, doing things really soft and easy. And then we can assess and figure out, like, where do you want to go from here? Is this something that, you know what, I want to do this naturally and not include some medications or hormones, or do you need to see your doctor and get a panel done and find out, okay, what you need to do to satisfy those balances of hormones? So that's totally out of my bailiwick. That is your lane. I love that you're a woman of color doing this. Women can get some real good information on what this process is like, and you're doing it and helping so many women as a medical doctor with your support of women on the menopause journey. So let's talk about what you do in your practice.
Sure, Beverly. So I have what I'd like to call a one-stop shop for health, wellness, and beauty. I started my journey in medicine with residency and training in family medicine. After residency, I worked for many years in urgent care. Urgent care is, great for acute issues, but not so great for, a lot of our chronic health issues, hypertension, diabetes, obesity, and even, some of our menopausal complaints. Not the best. Urgent care is just not the best arena for those sorts of issues.
Mhm.
So after or while in the urgent care setting, I was listening to people, and a lot of them had many of the same complaints. So I did further training in functional medicine, integrative medicine, and the care of the menopausal and perimenopausal woman. So that brings me to A Better You. I founded A Better You, your one-stop shop for health, wellness, and beauty about 10 years ago. We started in Odenton. Now we are in Laurel, Maryland, and I really help people look better, feel better, and function better, and both men and women. So men also struggle with or suffer from a lot of the symptoms of hormonal deficiencies that women struggle with. Um, what are some of these issues for ladies? A lot of times, Beverly, as you know, ladies talk about hot flashes as though, you know, it's the only symptom of menopause, but it's not. Um, Menopause and really perimenopause, which starts at least 10 years before actual menopause, which is 12 consecutive months of no menstruation or no bleeding. So, so 12 consecutive months. If you go 11, it doesn't count. You got to start all over. And
Right?
unfortunately, I've had, a few women who went 11 months and then had their cycle again and have to restart that count.
Mhm,
So
mhm.
what are some of the things that we are complaining about or talking about during that perimenopausal journey that starts a good 10, if not more years before the actual cessation of our cycles. So there's the trouble sleeping, whether it be for some people just falling asleep, for others, it's trouble staying asleep. It's the lack of energy and fatigue during the daytime. It's the brain fog. You can't remember. You think you have dementia. You can't focus. It's the increasing belly weight. It's I'm doing all the right things, or what I think are the right things, and the weight is not coming off. It's why am I so irritable? My anxiety is increasing. I feel kind of down, kind of, blue. Many people are saying today they just feel blah.
Oh,
That's what they're saying. It's the joint pain. It's the weakness, the physical weakness. Can't open jars, supermarket bags are heavy. And a big one is loss of libido. Libido is your desire or your appetite for sexual relations with your partner. So you have no interest or a much lower interest in sexual relations. And then for the ladies, it's the vaginal dryness, which can make sexual relations kind of uncomfortable. It's the hot flashes and the night sweats. And then for the men, it's some degree of erectile dysfunction. So those are most of the common symptoms of menopause that ladies experience 10 or more years even before actual menopause, and also men experience during andropause, or a decline in their testosterone levels. That was a lot, Beverly.
oh, thank you for that. Because in my mind, for those who are here, you have totally informed them about the menopause journey and the stages. I have a separate video that I talked about that. So thanks for bringing that into the conversation, because it's so important to kind of identify where you are, and then like what kind of symptoms might be showing up in your life during that time. And for I actually had a gentleman on so we can have a conversation around what it's like for the partner of a woman to watch their struggle through and how they can support, and knowing that the men also are challenged with this hormone fluctuation, because andropause is what they're dealing with, and it's the erectile dysfunction. So thank you for putting that all out there, and it's encapsulated in our conversation. So how do you support women? I'm going to kind of keep the focus in
Absolutely.
menopausal coach, even though I have helped a lot of men on this journey. How do you support women who come into the office and they like, Dr. Karen, I have all these problems. Help me. What can you do to fix me? Sometimes they feel like they're broken and they're not broken.
Sure, Beverly. The first thing is to validate the patient, right? I hear all the time, gosh, my doctor thinks I'm crazy. My friends think I'm crazy. My spouse thinks I'm crazy. Am I crazy? Are these things that I'm going through really real? I don't feel like myself. So the first step, I think, is really to validate the patient. Let her understand and let her know that she's not alone, and what she's feeling, what she's experiencing is real.
Yes.
So once we get beyond that, we have to do blood work. I have to be able to show you in black and white where your levels are, so I can show you how they are consistent with how you're feeling and make it real for you.
Okay.
So validation and show blood work. I have to see blood work.
Okay, that's really good. And that's why I love what you're doing as a woman of color. And let's speak to this. It's a little dicey, so I'm not going to go too far out there. But in conversations, I'm in so many circles with women talking about their experience of menopause. And I hear a lot of things relating to not being heard when they go to their doctor. And I don't know whether it's their OBGYN, general practitioner, I don't know, but they feel like they've been dismissed in some manner, or totally misdiagnosed and given medication that really didn't address them being on that menopause journey. And for me, in having conversations with many women and having summits that I've run for years, some doctors just did not have enough understanding about the menopause journey and how women need to do some lifestyle shifts rather than just giving them medication because you're complaining about not feeling yourself and here's something for your depression. So can you speak to that, because you say you acknowledge that this woman is going through something which is so important.
Right,
Women
right.
are, it's challenging enough to make sure we're getting good medical care and to be dismissed because we're not validated. Let's address that a little bit.
Yeah, so honestly, Beverly, we are not taught a lot of these things in traditional medical school or in medical school in general. So it is frustrating, um, just that being true. And then the second part is, we're seeing a lot of patients being prescribed antidepressants for their menopausal or perimenopausal symptoms. And guess what? A lot of those medications exacerbate
Absolutely.
the peri and the menopausal symptoms. So that's very, very frustrating. And if they're not exacerbating your existing menopausal symptoms, then they're giving you new and different side effects, which you sometimes cover up with another medication. So not the route I'd like to take with my patients. I'm the one who really want to minimize the number of medications you're taking, because a lot of times there's a lot of duplication in medications, which again, cause more side effects.
hmm Dr. Karen, that's why I love you so much. You're very transparent and you're very open. I don't feel like this conversation is out there openly enough so women can understand that they have to take control of their health and be empowered. And to me, I think that that's where I come in. I love being educated. I will be a person that will always be a student. And when I was going through my perimenopause journey, I have to admit that my journey wasn't challenging, but I truly feel like it is my lifestyle. I truly feel like it was my lifestyle. And there are women that I've talked to. I did some market research to
Mhm.
understand like what women are going through in these various stages and how they would like to address the symptoms that they're going through. And what I found out in general is that the symptoms are different from woman to woman. There's no cookie cutter, like everybody goes through their menopause and it looks just like this. So that's a new one. Like my mom went through it this way, you might go through something totally different. So just understand your journey is your journey. And the second one was that women said they would prefer to try to do it naturally and holistically if possible. And if it didn't work, then they would take the next step. And that's what I advocate for. Let's try to make some small steps to see if we can improve some of the symptoms that you're going through. And most of the women who had the same experience that I had, that it was very minimal, or they didn't even realize that they had been on the menopause journey, was because they had a lifestyle that was eating properly or eating in a healthy way, exercising or moving the body, doing things for mind, body, spirit. Like this was part of who they are. And my journey started for me in college. I got introduced to strength training. I got introduced to yoga. I got introduced to all these things. And then traveling around the world, I was also introduced to different modalities of health. And growing up as a baby boomer with grandmothers and great grandmothers who would go outside and grab bark or grab grass, and she had some tincture or remedy. So it was just natural for me. So can you speak to lifestyle being something that could impact them on this journey?
Oh gosh, Beverly, lifestyle is the cornerstone of not only perimenopause and menopause, right? It's for everything. It's for your diabetic patients, it's for your hypertensive patients, it's for your, heart disease. Lifestyle is the foundation of living a quality life as we age. So it's not only important as women go through perimenopause and menopause, what we eat and how we move and how much we move is very important. And we're seeing today the connection between our gut biome and
Mm,
brain health or and mental health. So it's all connected. Many people or patients don't know that our gut is 70 to 80% of our immune system. So a
mhm.
healthy gut is a more healthy person or patient in general.
Yes, I did a deep dive on the microbiome probably about 5 or 6 years ago. There was a lady by the name of Dr. Allison, I want to say her name incorrectly, Buckner, possibly, but she did a lot on SIBO, small intestinal bacterial overgrowth, because
Mhm.
people were complaining about digestive problem and not really understanding why. And that led me to understand like how we eat and how we nourish our microbiome has a lot to do with it. So there's another doctor that I was following, Dr. Zach Bush, I think it is, and he was talking about the soil, how important it
Oh,
is
my.
that we eat food that came from soil that was nourished and turned over and not stripped of its nutrients and laden with pesticides and preservatives. So this to me is back to my upbringing as a child. We had gardens, we had farms, everything we needed was available to us. We didn't have to rely on going to the grocery store to get something. So I'm a big proponent of eating vegetables and fruits and things that are natural from the earth because my nutrients that I need, the vitamins and minerals, are there. I think the convenience of life has contributed to some of the problems that individuals are seeing with their health and also with the hormonal disruption during menopause because they cause problems. You're eating food that's not real, laced with that are in disrupting what you're trying to clean up so you can feel better. So can you address that?
I know you're preaching to the choir, Beverly. You know, the soil now is so poor and lacks, much of the minerals that we need. That's why it's important to supplement our diet, our good diet, our healthy diet with supplements, right? We need good probiotics, we need good prebiotics. Now we're seeing that when we lack certain um, um, bacteria in our gut, it's harder to lose weight. It's We have more anxiety or mental health issues, again, going back to the poor concentration of good bacteria in our individual bodies.
That's really true. So when you're talking to your patients, the women,
Mhm,
and they want help in some hormonal replacement options,
mhm,
speak about what you prefer in that arena because there's bioidenticals, there's hormone replacement therapy. There's so many aspects of what women can do to help bring about a little more balance and feel good and get rid of some of those symptoms. As a medical doctor, can you talk about those?
Sure. So when you talk about bioidentical hormone replacement therapy and just hormone replacement therapy, they're really different. Hormone replacement therapy consists really of synthetic hormones, right? Synthetic hormones. And sometimes these are from um, equine or horse urine, which looks nothing like that, the hormones of the human body, right?
Mm-hmm.
And when you talk about hormone replacement therapy, you're not supposed to be on that therapy for any extended period of time, really more than 5 years,
Mm-hmm.
because that can have some deleterious effects on your body when it comes to cancer, stroke, blood clots, and things of that nature. When you talk about bioidentical hormone therapy, they're usually made from yam and soy, and the structure is identical to that of the human body. And that is why we don't see the same health risk as far as cancer, blood clots, and strokes, heart disease, and so forth with giving bioidentical hormones because they look just like and act just like our natural, normal testosterone and estrogen. And
Mhm.
also progesterone is also made in a bioidentical format when chosen.
Okay, that sounds really good. So I want to talk about how you support women with the bioidenticals. But before we go there, let's talk about these three. I think it's like the sex hormones we usually think about that causes this disruption as we're going through the menopause journey, your testosterone, estrogen, and progesterone.
Right. So ladies and men, when we think about testosterone, I think we think it's just about the men, but it's not.
We have it.
We all have testosterone receptors all over our body that is important for function in general. And once we start losing our testosterone, which really starts in our 30s, if not before, then the energy levels decline, brain fog starts to kick in. So you can feel a gradual you're more symptomatic as your testosterone levels decline, both in ladies and men.
Mm.
Um, as far as the estrogen, those when your estrogen levels decline, so that's the time when you have the vaginal atrophy, vaginal dryness, and that's where the hot flashes come in. Night sweats are more related to declining testosterone levels. That's why we can, I know we're not talking about men, but that's why men can have night sweats, and women do have night sweats, but they also have hot flashes. The hot flashes are related to the estrogen, the night sweats more so the testosterone levels. And we give progesterone always to a woman who's getting estrogen who has her uterus. If she does not have her uterus, then she's only getting testosterone and estradiol. If she has her does not have her uterus, then she's just getting testosterone and estrogen. If she did you get that? Did I say that?
Because I'm thinking questions to ask you about that because I've never heard it broken down that well.
Yeah. And then for our surgical menopause patients, and those would be a lady who had a hysterectomy, she goes into a surgical menopause. And a lot of times, or sometimes, you'll keep your ovaries and you may not become too symptomatic for a little while, maybe 6 months, a year or so, but eventually you'll start to feel different because the estrogen levels now from your ovaries are not functioning as they did prior to your hysterectomy.
Interesting. I had never heard the distinguishing hormones that identified night sweats
Oh.
and
Mhm.
hot flashes.
Hot flashes.
So interesting for me to hear because when women talk about hot flashes, I didn't really have hot flashes. To me, it's like when I go work out and I might have a little glistening on my tits,
Mhm.
this like that. And I would hear people talk about, I got to take my wig off. I'm
Yeah.
like, I don't have that. I don't know what you're talking about. But I did have night sweats.
Mhm.
For me, I felt like it was something that I was doing that contributed to the night sweats. I'm the kind of person I kind of felt like I've been anemic most of my life. So I'm always like wrapped up in blankets and all of these fuzzy warm clothes when I get in the bed. And I'm over that. That's years and years and years ago. I'm like postmenopausal, like 15 years.
Mhm.
For like throughout the night, at one point I remember like, okay, this has got to come off. And then, trying to fall back to sleep, like, oh no, let's pull this one off. And then after a while, it's just that the covers are coming off. And it was kind of funny to me. It's just like, well, why don't you go to bed with the appropriate attire so you don't have to go through this
Mhm.
dance of removing your clothes? But I wasn't aware that it was basically the testosterone in addition to me just overly dressed for bed at night.
And sometimes, Beverly, it could be a matter of, what you drank or what you ate. Sometimes we have triggers. Um, Red wine can trigger some heat. Um, Certain foods with certain spices or ingredients can also trigger some physical reactions. So I often will have a patient, a female patient, keep a food diary and drink diary and a
Mhm.
symptom diary and try to coordinate so she can see herself
Was in
what may be causing the hot flash or night sweats or, whatever.
Right. That is so true, and that's what I did with my clients as well. And for me, what I found out is wines
Mhm, mhm.
definitely would disrupt my sleep.
Right.
Definitely. And what I have done over the years, I am a wine drinker. I grew up, it was like everybody in the neighborhood had to make the best wine for Christmas parties and stuff. So we would be smashing grapes and having like fun experiences around this winemaking process when I was growing up. So I have an affinity to it. And then I moved to California and lived there for like 6 years and did wine tasting and found out about all of these other options. So I was always on the search for the best wine. And then I traveled to Europe and went to Italy and Paris. It's just like, oh, this is wonderful. But I realized when I was in the European countries, I didn't have the same experience drinking wine that I had when I drank wine in the United States. So thus that led me on another
Mhm.
to try to figure out like what's going on. And I found like the California wine industry has such a lobbying arm to it, and they're laced with so many excessive chemicals and preservatives, and that's why it was causing disruption for me when I was having wine, as opposed to the process that they use in Europe is more artisanal and they don't have all of those chemicals. So what I had to do for myself, because I feel like there's always a way around the circumstance. So I'm a wine lover. I will never give up my wine, I don't think. Did research, and there was a gentleman who was a avid enthusiast for health and wellness, but he loved to have a glass of wine at the end of his evening. So he partnered with scientists and wineries, and they came up with this line of wines with no sugar. And that was a long time ago. And now you're finding that there's these wines that are all over that are being marketed no sugar or low sulfides or low alcohol.
Mhm.
Cameron Diaz is a person that I followed a lot because she talked about health and wellness and how she was trying to change the wine industry. And she has a line of wines that have no sugar. So now I can still enjoy my wine, doesn't have the sugar in it, low alcohol, and it doesn't disrupt me, and I can enjoy it. So you have to, I feel like, take control of your journey. There's a way to navigate this and still enjoy some things, but you do have to be cognizant and make a lifestyle shift because sugar is not your friend during this stage.
Absolutely. I
So,
totally agree, Beverly.
on a tangent, so is there anything you want to add to that?
No, that goes, what you were saying, Beverly, goes right back to what you said before about what when we're talking about the soil and how poor nutrition and all the pesticides and all the junk that's in our food these days. It's the same thing for the wine, and why your body told you so when you drank wine in another location.
Yes, so definitely has been something that I am a big advocate of.
Mhm.
Vacation is the place that I take my women through when they're coming to me with a lot of these symptoms. And I'll tell you, Dr. Karen, out of the majority of my clients that I've had, they went through a 180 shift after going through a detoxification. And I'm not talking a detoxification where you're taking laxatives and all of these pills to purge. I'm like getting rid of these things that are disrupting your hormones, the sugar, the excess preservative, eating foods that's packaged, like going
Mhm.
back to the basic and eating to nourish your body, and also being aware that there's toxins that are coming in
Mhm.
all over and trying to make choices to minimize them. Like me, I used to model and I used to have a full face of makeup and I loved makeup and I still do. But now I am just so much more conscientious. I try to do minimal makeup. I try to look for the ingredients that are in the makeup, what type of testing they're doing, because what I'm putting on my skin, it's going and absorbing into my pores, into my body.
Mhm.
I'm watching the food that I'm eating. I'm watching the products that I'm putting on. That goes for my showering products. I used to be well, still am a Avon representative, and there was this special lotion that my grandmother used and swore by because her friend was an Avon representative, and They had such an impact on me, so I became A1 representative. But I had used this for my entire life. And then once I started looking at packages, I'm like, let me look at what's in this lotion. It is like the worst combination of things that you can have. So there's this app that I use called Yuka, and you can scan the barcodes on packages and find out the level of toxicity. And they'll grade things from like 0 to 100, 0 being the poorest thing. And they'll give you some options if it's like 0 or poor, and then 100 being the best. This lotion was a 0.
Mhm.
And I was just like so infuriated because this is 2024, 2025 practically. These companies don't have to put that level of toxic substances in products that we're using. So the way I am taking my power back is to choose not to patronize these companies that have such horrible products. And I'm finding more natural products. And I'm going to stop. I know I can go to 10 because I love
That's
this subject so much. Um, I'm in a group with some ladies, and we try to do outings like once a month. And one of the things that we're going to do was go to this body butter class to understand how to make your own like moisturizers for your skin. It's
okay.
all natural, as opposed to buying something that has a 0 level of goodness for your body. So just taking those little steps, and if you look at the big picture, every little shift makes a difference and make you feel better. I am so happy and good in my body. That's the sexy side of menopause, because I had to make the decision that I want this to be the best time of my life.
Well, you look amazing, Beverly.
Thank you. Try to look like you, Dr. Karen. That's what it is. Try to look like you. But I know you also provide um, bioidenticals for your clients that help them feel amazing. So can you talk about the services that you provide in your practice to help
Yeah,
women with that?
sure, sure. So with the bioidentical hormone treatment or therapy, there are different ways you can do it. I happen to mainly do the pellet therapy or pellet treatment, where I implant a small pellet, which is like a rice grain, into the hip area. I make a small incision with a scalpel, maybe less than a half an inch. After I numb you with lidocaine, so you don't feel um, much discomfort. You may feel a little burning or stinging from the lidocaine. After that, you only feel pressure when I insert the pellet or the small rice grain, which has your hormones that dissolve over time. For ladies, that pellet will dissolve over a 3 to 4 month period, and then you'll kind of start to feel slowly like you did before. If you're having trouble sleeping, you'll start to have some disturbed sleeping. Your energy is going to be a little lower. You're going to feel your libido drop around that time. So you'll usually want more of what you had when you felt amazing, because you will. That's our number one service for both men and women. And like I said before, it is very safe. We encourage ladies to have their regular routine pap smear, mammogram, because that's just consistent with good practice and good health in general. And again, the lady typically comes back after 3 to 4 months for a administration of additional pellets, but then I do the left side. So I start on the right, then we alternate to the left side, then we go back to the right as we progress through the year. We do labs at least once a year. So after your initial lab service, you have the treatment, and then I want to show you the improvement. So you'll have post pellet labs at about 4 to 6 weeks after the pellets were installed. And then I'll show you the difference in your testosterone level, your estradiol level, and some other biomarkers that we use.
Wow, that sounds like the answer to everybody's problems.
Mhm. But there are other ways that you can benefit from bioidentical hormones. Like I said, I mainly do the pellets, but some ladies now are asking for creams. So If someone wants, we can, discuss the cream as opposed to the pellet. I just prefer the pellet because you put it in, you forget about it. You don't have to do anything with the creams now. You have to apply it every day. And one of the side effects that I don't personally like with the cream is that, if you have a small child or, your grandchild or your partner, there is some transfer. So you can give a little to someone else with contact.
Yeah, that's one of the things I did
But
hear.
not everything is for everyone. If the pellets are not for you, the pellets are not for you. If the creams are not for you, the creams are not for you.
Right,
And
right.
that's fine. We could talk about different ways to achieve similar results.
Well, that's the wonderful thing. There are options. So it's like, okay, if a holistic approach is not for you, then you have Dr. Karen who has the bioidenticals. I prefer bioidenticals if I had to make a choice.
Mhm. Same.
Big fan of Suzanne Summers. I had bought
Mhm.
her books, and she had talked about the experience of working with doctors in different parts of the world, the bioidenticals. And to me, that seemed to be something that was much more in line with my way of thinking, and
Mhm.
having a lot of synthetic things that was cooked up in a lab and put in my body. And I
Right.
don't know what type of outcome I'm going to have as a result of that. And then there's this constant tweaking because you might take something and it doesn't work and you go back. So I've heard a lot of experiences of women who has opted for hormone therapy. Haven't had a lot of conversations with women who have utilized the bioidenticals, but because of Suzanne Summers' book, I had a lot
Mhm.
of her case studies.
Mhm.
I had felt comfortable enough about it. And then the holistic. For me, the holistic has totally worked. I feel like if I had to do it again and I wasn't getting any results, then that would definitely be the route
Mhm.
I would take.
Mhm.
And I would definitely be searching and seeking for a person like you, Dr. Karen, because having a true understanding of your body and what opportunities are available to help you through this is very important, and not being dismissed by a doctor. And you are truly there serving women to the highest level. And then on top of that, you have the beauty aspect. So let's talk about beauty a little bit, because I am the person that has a self-care list and I am always in my esthetician's office.
Yeah. So, I mean, I think you really look as young as how young your skin looks. So taking care of your skin is so, so important. As much as I, love administering Botox because, you see the fine lines and wrinkles go away, but there's nothing more that I don't like. I don't want to just be giving you Botox. I want to help you take care of your own skin. So it's a choice for you to wear makeup if and when you wear makeup. So skincare, 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 whether it's through, chemical peels, microneedling, regular microdermabrasion, simple facials, um, services that um, collagen biostimulating services, things. Those are the things that you want to be doing to enhance your skin, to make it look younger. And then a little Botox here and there is fine, or maybe a little filler here and there is okay too. But skincare is most important, right? We also help patients um, with hair regrowth with your own PRP that we inject into the scalp. We can also inject PRP, which is from your blood. We take your blood, spin it down, take off the yellow stuff, which I call liquid gold, that has your platelet-derived growth factors, stem cells, growth hormones, and so forth, and inject it back into key places like the scalp for hair growth, like the face for skin rejuvenation. I inject it into no, we're not talking about men. I inject it into the penis for erectile dysfunction, and to make that work a little bit better, we can also inject it into the vaginal area for ladies who suffer from not incontinence or not being able to have orgasms and so forth. So that PRP, like I said, is liquid gold. We also do laser hair removal. Medical weight loss is always something that people are interested in, and we can help you in any way you want to do weight loss, whether it's through, the GLP-1 injections, protein programs, detox, we have weight loss coach or health coach that can help you just with lifestyle modifications that you can make to help you lose weight without any medications or products. So we have something for everyone. So erectile, we help men with erectile dysfunction, medical weight loss, laser hair removal, IV hydration, different vitamin therapies, you know, hangover, you just feel like you need an immunity boost, you know, we can help you with that. I'm sure I'm probably forgetting something. We do so many things. I think that's about it. One-stop shop for health, wellness, and beauty.
Dang, I knew you did quite a few services, but there's a couple you mentioned there that I didn't know that
Oh,
you did, and I had did some research on it. So let me ask you this one because my podcast is the Sexy Side of Menopause, and if
mhm,
you're not feeling sexy with your partner and you're not enjoying this experience because your hormones are shifting,
mhm.
I understand that there was like a process to build up the atrophy of the vagina so you don't end up experiencing the difficulty that happens because the skin is thinning in that area. So that's like restructuring, I think, to some degree. Is that something that your office provides? Because there was an office that was near me that opened up, and I was interested in popping in to kind of hear about that process.
So I'm not sure, Beverly, if you're talking about like plastic surgery, like vaginal rejuvenation type services. No, I don't do that.
It was
Uh,
rejuvenation. Definitely was rejuvenation. Mhm.
so that's a lot more invasive and different than injecting back your PRP into that area. While the PRP injections are helpful and beneficial, you know, plastic surgery, that's something a lot different and
Okay.
of course more invasive.
Right. I knew it was invasive, but I didn't realize it was as involved like plastic surgery. It was marketed as if it's something you can come in and out and have this procedure done. But I
Yeah, it depends. There are devices that you can insert a wand into the vaginal canal to help remodel and tighten that area. And yes, offices like mine can and do provide those services. There's also treatments where you can, you know, sit on a chair and have it do Kegel exercises for you to help with the
mm,
different types of incontinence. So yeah, so those services are fine and safe to get in a Medi Spa office such as mine.
it was sort of like a mini med spa kind of. I don't
Yeah.
know the exact name, but I remember seeing it. But I think what I wanted to do is just let the women know, like, hey, go have the conversation, reach out to Dr. Karen. There are places that are serving women who are on this journey, who are finding that their body has changed. And if you don't have the ability to work to slowly get your estrogen built back up, there are shortcuts to it. Um, I had heard about the PRP, I think it is, and also
Mhm.
stem cells because one of my sons, he was playing sports and he had a major injury and they wanted to do surgery, or he can opt for this other where they draw his blood, spin it, and they explained it all to me.
Mhm.
I thought, hey, let's go that route. He was like, no, 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 I need to get back on the field and do my job. I need surgery. It's just like, yeah, the medical community has got another one of mine. But I understood it. And also,
Yeah.
I'm a person that had problems with my back, and I had read this book by Tony Robbins on life force, and he talked about how he used stem cells to strengthen his back. So there's a lot that's available.
So Beverly, that's interesting that you brought that up. I did stem cell training last December and I actually had my own right knee injected. And I haven't honestly, I have not had pain since.
I
So
need to, Dr. Karen.
so it is a service that, you know, while I don't have it, you know, out on my website or it's something, yes, that we do here where I inject your knees and I do some athletes. Um,
Yes, yes.
you can do your shoulders, your elbows, but knees are very, very popular and stem cell injections do work. And we can use them everywhere for hair regrowth, for skin rejuvenation. We can inject them into male and female genitalia for better function and so forth. So they're just amazing.
So ladies, you can definitely stay on the sexy side of menopause. Reach out to Dr. Karen. It's like she's your fairy godmother now. She can help you with everything. Dr. Karen, I love you so much. I love what you're doing. I love how you're supporting women and you're educating them. That's my baseline to give my ladies the basic understanding, because sometimes they throw their hand up, they have no idea. They just show up just like, okay, fix me. It's
Yeah.
like, wait a minute, let's understand what's happening here before you just have somebody to fix me. So can you provide like how someone can reach out to you to get your services? I know you're in the DC metro area, but I know you have like websites and
Sure. So my office is on historic Main Street in Laurel, 525 Main Street, Suite 101. Our phone number is 410-672-2700. Our website is a better you, that's Y-O-U, medispa.com. And you can always email me at info@betteryou-medispa.com. So that's ABETTERYOU, M like Mary, E, D like David, ISPA.com.
wonderful. And I will also include all that information in the section below this.
Oh, thank you.
Dr. Karen, I cannot believe this time has come and gone. You might have to be a regular
That's fine, Beverly, whatever you want.
because I need to come in and check out some of those services. Like I say, I am such an advocate of being the best version of yourself at this stage. And there's so many opportunities for us to lean into ways to be, who we aspire to be, even though there's something about aging that's happening. I personally am not a person that has a problem with aging. I just want to be able to move and be healthy. And I used to be a runner. I used to run for like 10 miles. And it's just like, I'm starting to feel a little bit. It's just like everybody's talking about, oh, you'll need a knee replacement. I'm like, never. What I came in here, I'm going to, but I am definitely a proponent of utilizing stem cells and your own blood platelets to be able to repair. There's just too much studies around that works for me. But we will be going on into another conversation. Dr. Karen, I am so grateful for you being here. I'm sure you'll have a lot of new clients that are reaching out because the service that you provide really helps women to lean into the sexy side of menopause. So thank you for being here, ladies, and we'll see you next time.
Thank you, Beverly.
You are so welcome. I've delightfully enjoyed every bit of the conversation.
Same, likewise.